Are we looking to eradicate disease? What are we really looking for? What is successful aging?
Substance abuse issues are treated differently than they are mental health issues.
The misunderstanding and the misinformation among the people who are making policy regarding health education for our youth.
And we really need to launch a true recovery-oriented system of care.
Tobacco is the biggest cause of preventable death and disability in our community. Tobacco kills more than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, murder, and suicide combined. And the thing is, it's entirely preventable, and we know the intervention. So that's why we take a lot of interest in that particular issue.
When they show the STD numbers, I mean, a lot of people are not aware of the huge HPV rates, you know.
We're not giving kids accurate information and accessibility to resources that can help keep them safe.
Using community health workers as someone who can go over to somebody's house and, hey, let's go hang out and let's talk about those issues.
And we have a lot of drug and alcohol problems without any resources at all in the Rundberg area. I mean, zero.
For us as a community to effectively address these important issues, it requires that cross-section, that dialogue, that communication and coordination and collaboration between so many of our partners in our community. And this is a great chance and forum for that to happen.
Finding Spanish-speaking clinicians in Austin, it's very difficult.
When you're talking about different Asian languages, African languages, they're not there at all, right? Or they're just really, really insufficient. So that's a huge barrier.
We discussed specifically the African American communities and the Hispanic communities and difficulty accessing mental health services and helping people understand that it's okay to seek help.
There's shelters for men, but there's not enough shelters for single females or females. There's not shelters for females with children.
When housing is developed, especially affordable housing, and when healthcare facilities are sited or developed, it's vital that transportation is at the table before those decisions are made.
Bottom line is, going after symptoms, prevention, and keeping people healthy, provided that you can actually create wealth, you are going to change the culture of healthcare.
Dealing with their children, really kind of learning what they themselves need to be successful parents and to be successful family members and caregivers.
And if we can agree on the impact indicators, maybe funders will be more likely to fund preventative programs if we can show that we're actually doing work.
Right now, family caregivers are providing enough care that equals all the Medicare and Medicaid spending. We need to support the work that they're doing.
Because our systems are fragmented, they don't talk to each other. And one of the solutions is just using technology to create the health information technology systems that will connect our providers.
The term that came up frequently was culture, applying both at a personal level and at an institutional level.
Having a stronger navigation system online, in person, more of a person-centered approach.
People have gone out there, bought their insurance, they can afford the premium, they can't afford the copay or deductible. So we need to provide them additional assistance in paying for those as well.
It would be nice that regardless of what type of coverage you have the same level of access.
So I think there needs to be a new term in which, when the schools are picking up a responsibility around behavioral health, when pastors are taking mental health first aid, when we have a situation where we have quick screens in terms of central booking, it's the whole community taking some ownership around not having folks slip through later in their illness for services.
Child care, when a person is has an appointment or has a need, a lot of times they're making a choice between their children and their own health.
Maybe incentives for convenience stores and local shops to have like tax breaks or something so that they can provide more healthy food in their store.
I think there needs to be a community health or public health advisory committee that explores what the needs are in the community, as well as, is this a true need? What are the solutions to address this?
Senior-friendly villages and neighborhoods
where, if you're not close to your family, but the whole community plays a part in being a part of the housing and taking care of the seniors who are living in that neighborhood.
To the extent that nonprofit organizations can, present data to private funders, provide them with information about the gaps, about the community needs. That's really helpful and useful because, again, many private foundations don't have the ability to be out in the community, conducting their own needs assessments.
Having the people in the community be a part of the intervention and discussing how they would like, what needs they would like to see met, and particularly youth, using those youth as peer health educators.
People don't often reach out or know to reach out for assistance other than just going to the emergency room. So there was a big push at our table about focusing how we might do outreach out into the communities and some things we've already heard about into the churches, into the schools, into the neighborhoods, the grocery store.
But we do want to see a place where people can go to one place and figure out what they need to do.
People have talked about a one-stop shop or multiple access points to the same system. Something like that's very important.
We decided we need more patient-centered care and control.
The need for adult coverage for dental services and policy changes related to coverage.
We have to educate our population, and in order to educate, we empower them. And it's not, regardless if you're homeless, HIV, STD, whatever.
It's you as well as me. It's all of our organizations together. It's the people that we serve. It's all of us together that can make this change or not.